diagnosis. In both the cases that I quoted, there was a mismatch there. There was a clear flaw there. Expectations, what is the patient expecting from us? And concerns, what are the major priorities or concerns? I have just requested Dr. Iqbal to share a link with you. It's a little Google form. We will come to that in a minute. No need to open it yet. Okay. So very often, as we saw, even when we introspected for a minute, our important concerns are often in the domain of family, finances, faith, fulfilling responsibilities or dreams. But there are also urgent concerns. If I've got 6 months more to live and I want to spend time with my family, if I'm severely short of breath, if I'm in agonizing pain, if I'm vomiting 3 times a day, it's difficult to do that optimally. So as doctors, we do have a duty to address those urgent symptoms, be they physical or emotional, so that the patient and family can optimally engage with what is important. So the urgent is necessary, and one doesn't have to be a palliative care specialist to learn the basics of pain and symptom control. We can all do that. Right, so if I could request you to play the video. The doctor here is Dr. Rajgopal from Trivandrum, Pallium, India. And the patient, you may not recognize her, but that is me about 25, 30 years ago. And so in the role play, I have an esophageal cancer, inoperable, incurable esophageal cancer with progressive dysphagia. So yes, please play it.
Shalini, how are you today?
I'm still finding it difficult to swallow, doctor. The pain is a little better with the medicines you gave me, but the swallowing, I'm getting worried.
Shalini, what do you think is happening to you?
Doctor, how will I know what's happening to me? None of the other doctors told me anything. I used to sit outside. They would talk to my brother.
Can we just pause the video for 1 minute? If you can just open your Google form, there are a few questions there. And keep those questions in mind as we go through the rest of the video. Yes, urgent and important priorities. This video is actually about breaking bad news, but I'm using it to illustrate priorities. Okay, so just have a quick look through the questions. I will also project them on the slide, yeah. And we can just continue watching the video now.
Just keep wondering why I'm not getting better, why I can't eat like I used to be able to. How will I know?
Did you want to know?
Of course I want to know. It's not easy sitting outside and waiting and wondering. My daughter is there. She's getting married 6 months later. And if I can't eat, how will I be there for her wedding?
Is that your major concern at the moment? Being there for your daughter's wedding?
Yes, doctor. She's the only one I have, and I have to settle her. It's the most important thing to me.
What's your own impression about what's happening to you?
I'm worried that it may be something serious.
And when you said something serious, did you have any particular disease in mind?
No.
Shalini, I am afraid it is indeed something serious. In fact, what you have is a kind of cancer.
Not cancer, doctor. Not cancer. I could have borne anything else, but cancer is the most horrible disease there is. Please tell me it's not cancer.
What I told you is indeed a very difficult thing to hear. I understand that you are considerably burdened by that bit of information I gave you.
I'm scared of cancer, doctor. It's terrible.
Why did you say it's terrible? I mean, did you have some personal experience with a friend or a relative or a neighbor or something like that?
When I was a child, my uncle got cancer. He had a horrible growth coming out of his neck. I used to be so scared of him. And then it started smelling. There were worms coming out. He used to scream in pain. None of us went near him. I can't go through that, doctor.
When I said cancer, was that what was going through your mind? Something ugly with worms crawling over it and a lot of pain and all that? I can assure you that it is not going to be something like that. Shalini, there are many forms of cancer, and what you have is not going to show outside. There's going to be no disfigurement, there are going to be no worms, and we are going to take care of your pain.
Are you really sure, doctor?
That's something that I can really assure you of.
Okay.
When your mental impression of cancer was something really dreadful, but things have changed in the last so many years since your uncle's time, and now we can take care of your pain. I know you are finding it very difficult to swallow something. That's something that we'll address. We'll find a way of getting some food into your stomach so that you will feel a bit stronger and less tired then.
Doctor, can I ask you something?
You do.
How long will I live?
I am afraid I don't know the answer to that.
Doctor, you don't have to be afraid of telling me the truth. I can face it. I need to know because of my daughter.
Charlie, one thing that I'll promise you is not to lie to you. I'll give you an honest answer, and honestly, we do not clearly know how long you can survive. Let us certainly hope that it can be a considerable time ahead, especially when we get the food into you and when we take care of your pain. But on the other hand, things could go wrong. It could be much less. And therefore, maybe it's good to be prepared for that. I actually talked to Arjun, your brother, and I was wondering whether it's possible to bring your daughter's wedding forward. And he thought it could well be possible.
My brother said that?
Yes, he did say that it was a possibility, but he wanted me to talk to you first.
No, if we could have the wedding, that'll really take away half my worries.
So I think, can we have this slides? So these were the questions which we had on the form. So maybe you could just take a minute or two to answer that in the light of the video. So I think, just to go through the questions, what was the patient's urgent concern? It was in the physical domain. She was unable to eat and swallow, and I'm sure Dr. Supe would have many good suggestions for what kind of stent or what alternatives we have. What was the most important concern? That was to be there for her daughter's wedding. She's a single parent, and this is her only child. What did the patient think immediately after hearing the diagnosis? This is where the gaps happen. She's got this impression, and when there is such a burning concern like this, do you think any further communication will get in when this is going round and round in her mind? It doesn't, So sometimes that initial reaction we have to address before we go on to discussing prognosis and options. Did the doctor address this before proceeding? He did. In fact, he asked her, what are you specifically afraid of? He couldn't have imagined what she was thinking of. She was actually not afraid of death. She was afraid of dying a terrible death like that. Did he respond to her urgent concern? He did. He didn't go into the details at this point. That would need to come. Did he address her important concern? He did. What did he do? He had talked to the brother and asked, maybe we should consider this. Very often what we say in palliative care is hope for the best, but prepare for the worst. There is a chance that she might survive by the scheduled days of wedding, but if we have it earlier, everybody is at peace. So I should probably slightly apologize for making you go through a Google form in the course of a keynote presentation. But through my years in cancer, there are so many, many times that I have got carried away by medical priorities at the expense of important priorities, that I thought just doing it helps us remember this, and also remembering what our own priorities are when our disease is incurable. So in 7 minutes, this video actually was about 6 minutes, the doctor has broken bad news, understood the patient's fear and concerns. He has honestly shared the prognosis without going into extra details which she has not asked for at the point. And he has helped her to identify both worthwhile and realistic goals of care. Of course, the question is, we don't have enough time, but I've come to realize that by listening to the patient and spending a little time in the early communications, we save a lot of time, money, heartache, and litigation later. Okay? Because if we didn't have this, she would be anxiously saying, operate my tumor, give me the latest chemotherapy, we'd be running after febrile neutropenias, and finally, nobody is happy.